Hi, everybody. My name is Jaron Watkins. I am from Little Rock, Arkansas, and I am a first year in the Medical Scholars and Public Health program. And today I just want to discuss the differences and similarities between the COVID-19 pandemic and the Black Plague, also known as the Bubonic Plague, and as well as talk about how epidemiology could have helped contain or isolate the pandemic. First, I want to start off by talking about the similarities between the two. Both have origins in parts of Asia and as well as an animal origin. So for the Black Plague, its origin or the transmission was from like rats and fleas, and for the COVID-19, it has said to be been from bats. And one of the biggest like ways that both diseases were spread was through like airborne. They're both airborne diseases, and a lot of the people that got it were sometimes asymptomatic from both in the COVID-19 pandemic and in the Black Plague. People go days without knowing that they're affected, and for in terms of the Black Plague, it would mean death, and sometimes for a case in COVID-19, it would mean death as well. And that kind of brings me into some of the biggest differences, and that is the death toll. The death toll from the Black Plague was around like 60% of the population. And in comparison to COVID-19, the death toll wasn't as high. And along with those differences, the Black Plague impacted less areas or like regions. It mostly like just comprised like European regions and countries. In terms of COVID-19, it was more global, and it was like had a higher like transmission rate. And I would believe that has to do with just like the ability for everybody to travel, and that kind of goes to how could have epidemiology help kind of isolate or contain the pandemic. I believe that could have been done like through isolation methods and as well as sanitation. I know back then a lot of procedures were unsanitary and didn't have a lot of knowledge of what was going on. It was just like unknown of like how to treat it. And so just being able to have those guidelines and like sanitations, I think would have been able to help contain the pandemic a lot more. As well as like evaluations of like treatments and risk factors as well. Without having those kind of like guidelines, you're unable to know how well you're treating people without like officially evaluating how well things are going with your message you're taking, and as well as risk factors. I know that for the Black Plague, they talked about how anthrax was actually could have been added to the death toll, and a lot of people could have anthrax while the Black Plague was going on. So just being able to evaluate that and like other health factors when they're able to aid in bringing down that death toll and able to help contain and isolate the pandemic.